Ladies and gentlemen, today we have a very special guest. He's an esteemed medical doctor. His name is Daniel Laroche, and he's director of the Glaucoma Services and president of Advanced Eyecare of New York. He is affiliated with New York Eye and Ear Infirmary and is an assistant professor of ophthalmology at Mount Sinai School of Medicine in New York. Welcome, Dr. Laroche.
Thank you very much.
Many people have difficulties with their eyes. What do you see the biggest threat to people's vision in this year and years moving forward?
Well, there are 5 main things people have to be concerned about. One, when you get close to age 40, you have a decreased ability to read because the lens does not focus as well. And so you start to push things away from you for reading. And so you have to be evaluated for reading glasses and make sure you have the correct spectacle correction so you can see clearly and reduce any strain on your eyes that can cause headaches. So that's one. When you get into the 5th decade of life, cataracts, that's when the lens in the eye becomes yellow. Just like with aging, the hair becomes gray, the lens in the eye becomes yellow and cloudy, and that can interfere with your vision. Not only does the lens be larger in size, when it gets larger in size, that can contribute to elevated eye pressure in the eye and contribute to glaucoma. And glaucoma is when you have elevated eye pressure. If I touch my eye now, the mean normal intraocular pressure is about 15. But with glaucoma, the mean intraocular pressure in those patients is about 18. It's usually associated with elevated eye pressure that can damage the optic nerve that's connected to your brain and make you lose peripheral vision.
When you increase the pressure inside the eye, it damages the nerve that goes from your eye to the brain, and that starts, first of all, in your peripheral vision, so your side vision, and that therefore starts to affect the way you see. Is that correct?
Yes.
Okay, so when that happens, what are the first signs that something is going on when a person is getting glaucoma?
Often you don't feel it. Glaucoma is called the silent thief of sight because when the peripheral vision is affected or the pressure is slightly elevated, you don't feel it at all. You will be seeing fine and not feel anything. And you need to lose about 80 to 90% of your vision before you even notice it because you have 2 eyes. One eye will make up for the other eye. And then one day, some people may just cover one eye and realize that their other eye is dark. And then they come in for an eye exam and they may have lost 90% of their vision already. And we cannot bring it back.
So and that's scary because if you've lost 80 to 90% of your vision, as you said, that is not repairable.
Correct. So that's why it's very important for people to get their eyes checked, to see their ophthalmologist, get a complete eye examination, eye history, get their vision checked, get their eye pressure checked, get their optic nerve evaluated, get a dilated retinal examination, and if needed, additional testing, like a visual field test.
Okay, let's slow that down a little bit. Again, I'm a doctor, and I wear glasses, and I get my eyes checked regularly, so I know exactly what you're talking about. But we have people that are on the show that maybe have not been to an eye doctor at all in their life. Like I suspect, Danielle, if you and I went down the street and we talked to people, I suspect less than 5 or 10% of the people have actually seen an eye doctor. Isn't that right?
Well, I'm in New York City, and New York City has many, many, many medical centers throughout the city, a highly educated population here in New York City. And so many people do have access to eye care. Many elderly people have Medicare insurance, and we have Medicaid insurance for people that are poor. So in our city, many people have had eye exams, but there are some that have not. And it's very important that we reach out to those.
Good. And that's what I want to make sure, that this is all inclusive for everybody that's listening, because this show goes around the world, Daniel. So The important thing for people is to realize that eye care is just as important as dental care, is just as important as taking care of your body. Otherwise, it doesn't work well.
Absolutely, absolutely. The eye is connected to the body, and it's very important for everyone to get an eye examination to check for these things to help prevent blindness.
Now, are there things that are related to glaucoma other than just age?
Age, family history, and genetics. People who have a history of trauma, people that are nearsighted, farsighted, uh, have systemic disease like diabetes, all have a higher risk of developing glaucoma. So it's very important that people maintain a healthy lifestyle. Just simple things that you can do, like eating healthy, lots of salads, lots of vegetables, drinking lots of water, keeping your weight normalized, avoiding starches like excess rice and bread. Exercise, walking 30 minutes a day improves the blood flow throughout your body and your eye and helps to maintain lower eye pressure. And meditation, meditating 50 to 30 minutes a day, relaxation, deep breathing helps to lower the eye pressure by about 20% and can lower your blood pressure by about 20%. Those are simple things that people could do at home to help improve their eye health and overall systemic health as well.
Cool. Now, when a person comes into an eye doctor, what are the tests they're going to do to specifically examine their vision and look for glaucoma?
Well, first we'll take a history to see how the person's vision is. If they also have any family history of glaucoma, if they take any medications that can contribute to glaucoma. Then we'll do an eye examination. We will check the vision in each eye. We'll check their eye pressure. Using a slit lamp examination, we'll take a look and examine the cornea, put a lens on the eye, take a look at the drainage angle, what gonioscopy is called. Take a look at the lens, place dilating drops to dilate the eye, take a look at the inside of the eye with special lenses, take a look at the retina to make sure there's no retinopathy. And then we can do a visual field test where a patient will sit down in an automated machine that shines lights that the patient's asked to respond to assess their peripheral vision and their central vision. And there are also tests that can take images of the eye, pictures of the optic nerve, and measure the thickness of the nerve tissue in the eye to see if there's any early loss of nerve tissue. So this would be a comprehensive evaluation to determine whether or not someone has glaucoma or not. If they do have glaucoma, to monitor it as well.
Yeah, that's very good. What age should people start getting regular eye exams to test for glaucoma?
The American Academy of Ophthalmology recommends that everyone age 40 and above get an eye exam once a year to make sure glaucoma and check for eye health.
The Secrets to Living a Fantastic Life is an amazing read. If this book doesn't pick you up to sing above the crowd, I will be amazed. What great things do you imagine for yourself? Do you know what's holding you back? Dr. Allen Lycka, a prominent physician, has taken what he's learned from being handed a diagnosis of his pending death and turned that insight out from inside his heart and mind out to you. You may have heard the idea, it's not what happens to me, it's what I do with it. Dr. Lycka explodes this idea, this way of thinking and being, into 13 golden pearls for you to take one by one, practice, and string together like a necklace you will wear to guide you through life's challenges. Like metal that is tempered by extreme elements, so are we. Dr. Lycka will show you how to turn terrible things into real and practical new ways to lead your life. Believe it and believe in yourself. The Secrets to Living a Fantastic Life is an amazing book. Amazing. Get your copy today at Amazon.
Take a step toward bringing our country and community together. Start a meaningful conversation at lovehasnolabels.com/onesmallstep. A message from StoryCorps, Love Has No Labels, and the Ad Council.
What if you're in a high-risk group? Should it start earlier than that?
Yes, that's a good question. People who have a family history of glaucoma, or people who have someone in their family that's gone blind from glaucoma, those types of glaucomas can be much more aggressive. And if you have that type of knowledge of your family history, you should probably get checked once a year, starting at a younger age, as young as 18 or 19.
Yeah, that's pretty important, and I think that is very significant. That in those groups, people need to get checked regularly, and even more so. So I think people need to be very aware that if you have a family history of glaucoma, or you have diabetes and things like that, certainly you need to be checked regularly. And I think that's what this shows can help you do, is point you in the right direction so you make sure you get that care.
Yes, indeed. Yes, indeed. Thank you for the opportunity to share this
Okay.
information.
So, sir, I interrupted you and I apologize. We were going to go on to point 4 that you said on your list of eye disorders.
Yeah, so the fourth point was retinopathy. We have a huge epidemic here in the United States of obesity. And with that obesity is diabetes as well, and hypertension. And these diseases can lead to blindness with strokes in the eye, diabetic retinopathy that can lead to hemorrhages and fluid buildup in the retina, and loss of vision. And so it's very important that if you have diabetes, obesity, hypertension, you get your eyes checked for retinopathy. Also, if you do have these things, it's very important to take this disease in your own hands, because a lot of times we're using medications to treat the disease, but you can take the disease in your own hands by just changing your dietary lifestyle, increasing your exercise, reducing stress, adding meditation to your lifestyle. That can make a profound change. I've seen many of my patients who have undergone these things actually get rid of their diabetes completely, improve their vision, get rid of the hypertension by making these types of changes. And so that's very, very important.
Now, as you said, this is very much an epidemic that's going on right now, that there's so many people that are obese and having problems. That is certainly something we have to address.
Yes, indeed. And the fifth thing is macular degeneration. This occurs later on in life, in your 6th and 7th decade of life, with excess exposure to sunlight and or just age-related as well. That's a leading cause of blindness that you want to get checked for, because we do have treatments for macular degeneration. There's 2 types, a dry type and a wet type, where abnormal blood vessels grow in the macula in the back of the eye that allows you to see. And it's like the retina is like a piece of dry film. Okay, when the film is dry, you have a clear image. But if the film gets wet from leakage or macular degeneration, then the image becomes blurred. We want to prevent that. And we have treatments with early detection. We can give you injections of anti-VEGF medication that can help get rid of these abnormal blood vessels to preserve your vision. So we have this new technology that's available, and all these things that we can do, it really depends on just screening and getting your eyes checked and picking up disease early, so we can give you the appropriate treatment to prevent blindness.
That's pretty important. Are there other diseases of the retina that people should be aware of?
Those are the major ones that are out there in terms of leading causes of blindness. There are other less common diseases, genetic diseases, and things of that nature that are out there.
What if a person wakes up and all of a sudden they're starting seeing flashes and stars and things like that? Is that not a retinal disease, sir?
Yes, that could be. Flashes, floaters, seeing stars, that could be signs of a retinal detachment. That could be signs of inflammation in the eye. Those are less common than what I was speaking about, but floaters are quite common. But very rarely do they result in retinal detachment. And what is a floater? Inside the eye, you have a jelly of fluid called a vitreous. As you get older, that vitreous gel contracts a little bit. And when it contracts, there are certain attachments it has to the retina that can lead to tugging and pulling away of some retinal cells that can float around, and or pulling and creating a retinal tear or break. That's what causes the flashing lights when you have that type of traction. And you can see a sort of a crescent moon or dark shadow. That could be a sign of a full, complete retinal detachment. And if you see those things, you want to go see an eye specialist right away. Floaters alone are quite common, but the retina specialist or eye ophthalmologist will do a retinal examination to look for retinal tears and retinal breaks. Most of the time, you don't have that. But, less often, maybe 1 or 2% of the time, you may see something like that needs to be treated.
And that's why I wanted to bring that up, because that is one of the true ophthalmological emergencies there is. If a person waits too long with a retinal detachment, they could go blind.
That's correct. Retinal detachment is not that common, but when it does occur, it's very serious, and you want to get that treated right away.
Yeah, very,
People
very.
that are very nearsighted, have high myopia, are at higher risk for this. So if someone has a very highly myopic prescription, -3, -4, or higher, they have to have a peripheral retinal exam once a year to make sure they don't have any retinal tears or retinal breaks.
Yeah, I was fortunate. I had some floaters and some stars and so, but mine was not a retinal detachment. It was just what is called the vitreal detachment. So I was very fortunate that it didn't proceed to anything much greater than that.
And that's the majority of the time. That's what happens in most people. So that was good.
I also understand that you have some other things that are very unique about you, Daniel. One is that you are a person that's multi-talented. You wrote a song featuring the voices of 2 of your patients to increase glaucoma and cataract awareness called Eye Pressure.
Yes, indeed. This is a CD over here that we have. It's called Check Your Eye Pressure. The song is Eye Pressure because people, many people transmit messages through music and through song to educate. Half of the people in America that have glaucoma do not know that they have it. And that number is even greater worldwide. In developing countries, many 80 to 90% of the people do not know that they have it. And so in addition to education through the media, directly talking to patients, giving lectures in the community, I had 2 of my patients who were very good artistically. I approached and I talked to them about, doing this song with me that I had written on educating the public about cataract and glaucoma. And they did a great job with an arrangement to put it together as well. And we were able to release it on Spotify, iTunes. We have it in CD format. I give it out to my patients. I give it out to people in the community. I share this song with different media, such as yourself and other people, just so that people encourage people to play it at family gatherings or social gatherings and parties, just to educate people about getting their eyes checked and preventing blindness from cataract and glaucoma.
Are you tired of feeling frustrated, unfulfilled, and constantly telling yourself that things will get better someday? Perhaps you have this burning feeling of anxiety like you should be doing something. Today, that can all change. Dr. Allen Stephen Lycka has coached thousands just like yourself to achieve the success you've always dreamed of. It's time to fully own your dreams and let go of those stories that seem to be stopping you from bringing those dreams to life. You can achieve your most ambitious goals and create the life you truly love. Ordinary people are now doing this extraordinary thing. Dr. Lycka will help you identify your purpose and make your dreams come to life. It's that simple. Your bright future is ready for you to claim it. All you need is to get clear on what you really want. The universe will take care of the rest, and Dr. Lycka will show you how to use the universal law of attraction to make this happen. Say goodbye to last year and get the success you've always dreamed of. Your change starts today. Contact Dr. Allen Stephen Lycka today for your coaching session. There is limited availability, so call today at 844-936-3362 or go to our website at www.drallenlycka.com. Change your life today.
Text and whatever. Just don't text and drive. Visit StopTextsStopWrecks.org. A message from the National Highway Traffic Safety Administration and the Ad Council.
Nowadays with glaucoma, with early cataract surgery and microinvasive glaucoma surgery, we can really prevent blindness from glaucoma. The surgical techniques that we have nowadays are so much safer. We can keep people off of eye drops with the earlier intervention curve of blindness with this new technology. And so I really have a passion sharing that with the public to help prevent blindness.
I'm going to try and play it.
Do you know how important it is to check doctor for your eyes? That's the only way you will know you have cataract. Do you know how important it is to check doctor for your eyes? That's the only way you will know you have glaucoma. Go check doctor for your eyes. That's the only way you will know you have cataract. Go check doctor for your eyes. That's the only way you will know you have glaucoma. If you are over 50, check your eyes for cataract. Go check a doctor before it's too late. Your normal eye pressure is 15. When he's 18, this could be glaucoma. Check a doctor. Go check doctor for your eyes. That's the only way you will know you have cataract. Go check doctor for your eyes. That's the only way you will know you have glaucoma.
One morning, I was totally blind. I went to Advanced Eyecare of New York. I had a laser surgery who was performed by Dr. Daniel Laroche. And after 3 to 4 weeks, I got my vision back. The staff was so polite and so care. Thank you, Dr. Laroche. Thank you.
Good vision. For your vision. Good doctor. Check it, doctor. For your eyes. Check it, doctor. For your eyes. Check it, doctor. For your vision. For cataract. Check it, doctor. For your eyes. Check it, doctor. For your eyes. Check it, doctor. For your vision. For glaucoma. Check it, doctor. He's good doctor. Check it, doctor. Check it, doctor. For your vision. Good doctor. Check it, doctor. For your eyes. Check it, doctor. For your eyes. Check it, doctor. For your vision. Dr. Daniel Laroche. Check it, doctor. Good doctor. For your vision. Good doctor.
I think everybody gets the idea there. Now they want to go dancing.
Well, it'll get some good exercise and improve the blood flow as well.
That would be a good thing, I think. I think that would be a good thing. So there, we were able to bring that one in too, Daniel. Tell us more about what's important about eyes. I mean, you live and breathe with these diseases every day. Tell our listeners some of the other things that they need to know in order to keep their eyes healthy and well.
Okay, for young kids, myopia we're having a big epidemic with myopia and nearsightedness. And it's because the young kids nowadays are staying inside a lot, they're reading a lot, and they're just doing a lot of near activity. And that makes their eyes grow and their eye prescription get bigger every year. To temporize that and to minimize that, it's very important that parents take their kids out to spend some time outside doing activities outside in the sunlight for about an hour a day, okay, to take a break from the inside near work. That has been shown to reduce the epidemic of myopia that we're seeing globally. And with this epidemic of myopia, that's going to increase the risk of retinal diseases and retinal detachments, things of that nature that we were talking about earlier.
Danielle, this show is called the How to Live a Fantastic Life show. How can people live a fantastic life by taking care of their eyes properly?
We live in a very visual world where there's so many things for people to see. And one of the greatest fears besides death or cancer is really loss of vision. So it's very important to take care of your health, okay? But like I said, eating healthy, exercising, meditation, seeing your eye doctor, seeing your general medical doctor. There's so many things we can pick up nowadays and treat to make sure everything is okay. And then do the things that you want to do because life is short.
Danielle, I've got to thank you for being on this show and informing people the importance of eye care and the important things of what to look for.
Thank you very much for having me. It's been a pleasure.
Thank you very much, sir. And